Simple dimple, simple dimple. Why you guys keep sneaking up on me? Well, anyways, it's the Bentist and we're back with another YouTube video. You guys have been loving these reactions so much so that we got another one for you. But first, let me know, should I make a whole reaction channel where I react to stuff not dental related and keep it over there? Let me know down below in the comments. Anyways, today we're going back to the braces. Get it, back to the basics, but braces? Yeah, you get it. And we're gonna go over professional teeth whitening. Now, I got a lot to say about professional teeth whitening, and you might know some if you've been following me for a little bit. But in today's, we're gonna go through and see the exact whole process of getting your teeth whitened by a dentist professionally. And is it worth the money? Let's go through it.
Before your whitening appointment, you'll often need a consultation appointment first, where the dentist will discuss how many shades lighter they expect your teeth to whiten.
100%. Before you do professional teeth whitening, this stuff is strong, so you definitely have to get a consultation before you do it. One, if you have super sensitive teeth, you're going to be in super pain. And if you're trying to go from something really yellow to like bleach white, we got to be honest with you and let you know that you can really only go up a few shades. You can't just magically blast through it in one appointment, with a lot of people think that. We're going to go over that later, but let's keep going.
Now, the first thing they will do on your actual whitening treatment day is usually apply vitamin E to your lips. This is just a protective measure to help prevent cracking and so your lips don't get dehydrated during the treatment.
100%. One of the things that you're going to notice is your mouth is going to be open for a really long time, and it's going to get that crusty crust. So we got to make sure we put a protective layer on it so it doesn't dry out. Now, if you've had braces, you probably had Vaseline or something like that placed on your lips for the same exact reason. You can use either or, it doesn't really matter. We're just trying to stop them from being like the Sahara Desert.
Next, they will place a retractor in your mouth.
Look familiar?
Looks intense,
same as
but
we use in braces.
not. Once it's in there, you're good. Just try to relax your lips and cheeks for it to be more easily inserted. It's very important that they keep everything dry and protected from the whitening gel throughout the appointment. So they will insert cotton rolls and gauze into your mouth, making sure they pack your cheeks to cover your salivary glands. That way you're not salivating everywhere.
That's another important thing. You don't want saliva going all over the place. This hydrogen peroxide stuff is really powerful. And if it starts getting mixed in with your saliva and then gets around, bad things can happen. Also, did you know you got salivary glands like everywhere? You got them under your tongue, you got them up here in the top of the roof of your mouth, you got them on the sides of your cheeks. They're everywhere. So by packing everything all around, you're not going to salivate and hence have a better whitening experience. Also, you notice the cheek retractor also has a tongue retractor to stop your tongue from going through, because even though you want to go licking, trust me, you don't want to go licking. What do you mean by that?
And also, the towel around the blue retractor is to protect the skin on your face.
Got to. That can hurt,
So
man.
after the preparation, after you're all set up, which takes only a few minutes, they will then place the liquid dam onto your gums. It's like a rubber shield. They usually place it around the edges of your teeth first, then fill it all in, so none of your gums, no gingival tissue, will be showing.
Good. Now this is really important because a lot of people I see that go to the dentist and stuff, most of the time they just put that outer layer on there. But she's right, you want to fill in the entire area, because anything on your gingiva can severely burn you. It can cause blisters, it can cause it to turn white. It's really bad. I'm not playing with you guys. This stuff is super strong. Like the stuff you get at the supermarket, this is like 10 times stronger than that. It's practically acid at this point, okay? It's crazy.
That of fake acid? Are you dying of dementia?
And they want to protect you from the whitening gel.
Exactly. So she's filling it up, looking good. You got the protective eye shields on there.
They don't want your tissues to burn, so they make sure they are properly protected. Next,
she's
they
light
will
curing
use
with
the
a light
blue
just to make sure it
UV
hardens
light
up,
harden
same
the
way
liquid
anything
dam
else
material,
works in
since
dentistry.
it's a light cured material.
Now this, don't
And
get
once
this,
you're all
don't
set
get this
up
mixed up
and
with
all
the
the
teeth
barriers are
whitening
applied,
light.
they will then apply the actual whitening solution onto your teeth.
Okay. Okay, I'm gonna pause it right here a little bit. It's weird that she's just dolloping it into the center. Really, you want to spread it out so it gets into the entire tooth. I'm sure she'll probably spread it out later, but yeah, what you want to do is you want to cover the entire surface. You don't just put a blob there and just hope it works. At least I don't think it would be as efficient to work that way. All right, so she's putting it on there. Look, it's still weird that the little dollops
They
like
may
that's...
brush it in.
Ah,
They
there
don't
we go.
have
She's
to, but
brushing
some
it.
clinicians prefer to. Remember that this whitening agent is super strong, so you do want to make sure that you don't touch it with your fingers at any point during the
100%.
treatment.
You know, it's actually funny. One time I did touch it with my bare hands on accident, and I had a big white blister. Literally my skin turned white, and it was there for like 10 days, and it finally went away. Luckily, I didn't burn it too bad, but this is a really big thing, and we do the same thing with etching in dentistry, and you can even get etch burns from the acid and stuff like that that we use in dentistry. So it is really, really important to stay super safe. And this is one of the reasons why we don't give this stuff for you guys to use at home, because you can really hurt yourself.
Then they will make sure you are comfortable and attach the blue light guide to the retractor on your mouth. This machine has notches on it.
Blue light, blue light, blue light. Now you guys have probably seen plenty of TikToks of me slamming the blue light and saying that it's basically useless. And for the most part, as far as home care stuff goes, it is useless. The science behind it is that it activates the hydrogen peroxide, making it stronger and penetrating a little bit better. Now, in your at-home formulas and that tiny little light you buy that literally costs like $2 from, wherever you bought it, it's not going to work. Now, in an experience like this professionally, this is a very, very high intensity light and also very high intensity hydrogen peroxide. But still, most of it, I think, is just to make it seem like it's more awesome, super expensive and stuff, just to make you feel like you got a little bit more of your money's worth, because it's expensive. It's like $500 to get teeth whitening from a professional dentist. It's crazy.
So if you move your head, it can come out of place. So they want to make sure you're comfortable sitting still before they press start. Once they press start, the first round is usually about 15 minutes, where your mouth is connected to the blue light machine. After the first 15 minutes is up, the blue light will turn off, and the whitening solution will be suctioned off of your teeth. And then they will most likely do a second round. So after the whitening solution is all suctioned off, they will reapply another layer of the whitening product and do the second round of the 15-minute light session. Remember, you're not supposed to move, and here I am on my phone not being the best example. Some offices will have a TV for you, and if not, make sure to bring your own headphones to keep yourself entertained.
And I'm one of those people, like, if you pull out a phone and do a selfie, I am back in there. I'm like underneath, like, yo, what up? Some dentists don't necessarily like it, so I probably wouldn't. But if you come to my office, feel free to take out as many selfies as you guys want.
The next 15 minutes. Now, after you're done with the second round, they may stop there, or they may do a third round where they suction off the whitening gel and reapply the whitening gel, and then connect your mouth to the light again for the third 15-minute session. It is common to feel sensitivity on your teeth, especially the bottom front teeth, but if you are feeling any sensitivity on your gums, you should always let them know so they can help you with that.
Now, that's a really good point, because sensitivity is something you need to say. If you do get this whitening, there's two different types of sensitivity you're going to feel. One in the teeth and one in the gums. If you feel it on the gums at all, let them know ASAP, because they need to take out everything. They need to make sure it's not on the gums so you don't get burned. Now, teeth sensitivity is really, really common with bleaching in general. And the reason is your teeth are full of holes, okay? You're almost like a sponge. And these bleaching and everything actually rips all the plugs out of this hole, and so the holes go all the way into the middle of your tooth or your nerve. So if you rip all the plugs out, air, water, everything can kind of find its way into the inside of the tooth, making it hurt or be sensitive. So if you have sensitive teeth, especially after whitening, maybe try remineralizing gel is really important, or just sensitive toothpaste in general. You can even get like a prescription level toothpaste, like Prevident 5000, I think is what it's called, and that'll really plug those holes so you don't have sensitivity issues.
So you're all done. They will take everything out of your mouth and rinse you out. For 24 hours after whitening, you want to avoid dark colored foods and liquids, and after that, back to normal with your regular brushing.
And she told you to avoid different colored foods and beverages 24 hours after, and that's because your teeth have to remineralize a little bit over that 24 hours. And actually, if you do something directly after, it can actually stick to it and make it worse faster. So you want to give it about a day in between, just to make sure everything's back to normal and remineralized.
Routine. If you had impressions taken on your first consultation appointment, they may also give you your take-home whitening gels for maintenance whitening and fast touch-ups at home. Some dental offices will also provide sensitivity relief gels if you're prone to sensitivity, which is something else that will be discussed during that first consultation appointment. Depending on the individual, you can get 1 shade lighter to 5 to 10 shades lighter. It just depends on your lifestyle and your enamel.
So there you guys go. Now that you know the process of professional teeth whitening, and shout out to Teeth Talk Girl, I'll put the link to her channel in the description below. It is time for the moment that you guys have all been waiting for. What do I think of professional teeth whitening? Is it worth it or is it not? Well, personally for me, I don't think it's worth it. And the reason is it's like $500 for professional teeth whitening from most places. And for that hour, you get a couple shades whiter. But what if I told you that a $50 box of whitening strips will do the exact same thing, just 10 minutes over a span of a week? So if you have 10 minutes every day for a week and you really just care about saving some money, then yeah, just get the whitening strips. If you don't care about money and you're like, hey, I don't care, just do it really quick, I don't want to worry about it, then maybe the $500 is worth it to you. Actually, in my office, I don't even offer professional whitening. We literally just give you guys the stuff that you can buy in the store. It's called Opalescent Go. It works really well. I'm not sponsored by them, but you can check them out if you want to. Other than that, the only really difference in the dental stuff is just stronger. So if you really don't care about that, you can get the same exact result with the basic stuff at the store. So that's my answer. Let me guys know down below what you want me to react to next. Thank you guys so much. I love you guys. You have no idea. Over 1.5 million followers. Thanks for the liking, subscribing, put on the post notifications, everything else. I'm the Bentist. We out. We'll see you in the next one. Peace.